advice do you have to homeowners?
Practicing that preparedness. Starting the conversation now is always going to be a benefit to any association out there.
And welcome to Recovery Report Live. I am excited for today's show. I'm Dan Odess, president of GlobalPro, where we manage your risk to recovery. We have managed more than $1 billion in recovery for our clients. Whether it's a community association or a business owner, we are your source for insurance information and news, real estate, business, whatever it may be, planning. We want to be that source of information you can use. So continue to tune in. Today's show is an awesome show. We are in May. May is the month of mental health awareness. We want to celebrate that. We want to break the stigma. It's a great hashtag. Check it out. I encourage all of you to search it on social media. We have an incredibly important guest, a pillar in our community that has been doing great work with the homeless, with this particular issue, and I can't wait to get to the interview. But before we get there, I want to hit on a couple important issues. Lately, we've been dealing with some renewals that have been really controversial for community associations. Why? Because there's many changes that are occurring in the insurance industry, whether it's from the actual legislation and law changes to the policy changes that we're seeing, and the extreme cost of that insurance and the inferior product that is being sold. So I wanted to give you, our listeners, our viewers, our audience, our clients, 5 things to look for in your policy. Number 1, wind-driven rain. Make sure you read the wind-driven rain provision. The wind-driven rain provision says a lot of different things in different policy forms. Don't assume it's one size fits all. Each one is different. Some refer to an event such as a named windstorm. Some of it refer to wind events that are not subject to the wind-driven rain limitation. Again, this is a provision or endorsement, or even, like I said, a provision that's been added to the policy. It started as an endorsement. It may be listed as an exclusion. Who knows at this point? It keeps changing. It keeps evolving. But make sure you look for it. Make sure you understand its implications and how it applies in the event that a hurricane or a named windstorm or a wind event were to occur. In many policies, those are 3 different things. Make sure that you understand how it's going to apply and how it's going to impact you, because when you're selecting between a 3% or a 5% wind deductible, if not even higher, sometimes I'm seeing this, or a named windstorm deductible, is it a calendar deductible, is it a per occurrence deductible? There's all kinds of things to consider, and the wind-driven rain endorsement, exclusion, provision of the policy is an important aspect of that. So don't only simply look at your deductible, also look for your wind-driven rain issues in your policies. A lot of people were caught off guard after Hurricane Irma when they realized their insurance companies were either denying or not paying for damages to their community associations or businesses because they were saying that, oh, this is wind-driven rain, it's something suddenly other than a hurricane. Very important issue to look for. Number 2, deductibles. Don't have deductible phobia. Don't judge your claim based on the amount of your deductible. A lot of times people are like, oh, I have a high deductible, not even going to report it. Well, you may have a calendar deductible, so maybe you're interested to report it. Or because your per occurrence deductible is not properly written, it may not even apply. So understand your deductible, look at it, understand how it may apply. Contact us, let us look at the provision in there. Maybe it doesn't even comply with Florida law, so maybe it's not going to apply in the event that there is a hurricane. There's specific language in the Florida statutes which will tell you whether or not it's actually in compliance and whether or not it's going to apply. Also, sometimes they conjoin things like wind and hail. These issues have been litigated, and the result is in favor of the insured. So an important issue, look at it, don't have deductible phobia. Number 3, limits. What are they for? I think as we trend towards a more expensive product and an inferior product, something we need to take a careful measure of are your sublimits. Look for your sublimits. What are those? What are they covering us for? Because what we're finding is where things typically were covered under the total limit of coverage, now they're being shifted over into a sublimit for lesser coverage. So look at your sublimits, understand them. Number 4, notice requirements. It never says immediate notice, it says prompt notice. But understand when that notice needs to be given. Sometimes it does actually give you a time frame to give that notice. And the longer you take to give that notice, the better argument the insurance company may, not always having it, but may have for prejudice. But Again, understand what the provision says, understand how you need to give that notice. Sometimes it actually says you as the policyholder need to give it directly to your insurance company. Sometimes it says to give it to your broker. Sometimes it includes the name and contact information of a specific company or individual that the notice needs to go to and how it needs to be submitted, whether email, certified mail, phone call, whatever it may be, you need to understand it. And the last one, and I've said this many a time, request a certified copy of your policy from your broker. Don't settle for a copy of a policy. Make sure it's the certified copy of policy. And if you don't know what that is, contact us, let us know. Basically what it is that you have an affidavit on the front where the insurance company is swearing to the accuracy of the forms and information, and that you have the full and complete copy of the policy. Why that's important is because, well, if you don't have it, then you don't have the product that you actually bought. You know, just imagine picking up the keys to the car and not actually going home with it. Make sure you pick up the keys and you take the car home with you. Make sure you have what you bought. It's really, really important. As I mentioned earlier in my monologue earlier in the broadcast, it's an important day for today. We want to talk about an important issue that doesn't get enough attention. We've talked many of times in prior broadcasts about community, about what it means to GlobalPro and our culture here at the business. So having on pillars in our community that are actually making a difference, that are doing things to positively impact not only our community, but individuals in them, whether they have mental health issues, whether it's homelessness, whether it's just doing a better job of recovering from loss and disaster. We want to highlight those individuals. We want to talk about that stuff. We want to make you aware of what is going on in your community and how they are helping you in our community recover from those loss and damages, how we're making a better community for all us to live in, and giving back is so, so important. We highlight a huge section of our webpage just dedicated to GlobalPro Cares and all the great things that we're doing, whether it's donating routes to churches, to community centers, to doing fundraisers, to whether collecting perishable goods or clothing and shoes. We are doing our part, so we want to highlight other individuals that are doing their part in this. And again, May is Mental Health Awareness Month, so I want to bring out our next guest because I'm super excited to have Miss Hilda Fernandez with us today from the Camilas House, which I know very well. I've enjoyed many of the events in the past. A little bit about Camilas House I want to highlight, and she's going to get an opportunity to talk all about it because she certainly knows way more than I do as the CEO. One of the largest nonprofit agencies in Miami-Dade with 10 locations providing a complex system of care. Hilda ensures that every individual served throughout its 40-plus programs receives the services they need to help transition from homelessness. And I think that last part of there is something a lot of people don't actually think about. They think, oh, we're just serving or providing services to homeless, but it's actually about the transition from homelessness, which I think is an amazing part. So Hilda, welcome to the show. Thank you so much for joining us today.
It's wonderful to be with you all. Thank you so much for having me.
So talk to us a bit about Camilas House, about the size, the operation, and how it actually serves the community. I know I highlighted a few things there, but from your perspective, what are you guys doing?
So, certainly we are one of the largest, but what I always, make sure I let people know is we're also one of the more comprehensive. We have, a lot of agencies in our community doing an amazing job serving the homeless. Some agencies focus on emergency housing, more commonly known as shelter. Others focus on permanent housing. We happen to be an agency that does, in the insurance business, what is it, cradle to grave? But in our business, it would be literally from before the street to people who are on the verge of homelessness, where we provide homeless prevention assistance, to specialized street outreach teams trying to convince the hardest, most service-resistant individuals because of severe mental illness to come into the system of care. Of course, providing emergency housing. We do that proudly because that's part of our legacy and our history. But we also we're a treatment provider. We're a transitional housing treatment behavioral health provider. We provide mental health and substance abuse treatment, including specialized programs like a 16-bed residential treatment program for adult victims of human trafficking, a very unique program and one of a kind here in South Florida. And then we prepare people to move on to where we really want all of our clients to end up, and that is in permanent housing. So, we started very humbly as a soup kitchen and a emergency shelter back in 1960, in a very, one of those pure Miami moments when the Little Brothers of the Good Shepherd were called and said, hey, come to Miami. We have a bunch of homeless Cuban exiles, and could you come and open a soup kitchen and shelter to help these, these Cuban exiles that are homeless that were running out of Cuba at that time. Because of Fidel Castro. And, the head of the order said, yeah, we'll come to Miami and, put together a soup kitchen and shelter, but it's not only going to be for poor and hungry Cubans, it'll be for anyone who's poor and hungry. And that's how we started in Miami many, many, many years ago. So you fast forward, we're going into our 61st year. And tonight, almost a little bit more than 1,700 men, women, and children will sleep under a roof provided by Camilas House, whether it's emergency housing, treatment housing, or most of the people that we serve, believe it or not, in permanent supported housing, where they're able to they've gone through the process, have stabilized, we've given them the skills and the ability to live independently and contribute again in their community and in their society. So we're very, very proud of what we're able to offer our community and have been able to do for many years, adjusting along the way. You have to make those adjustments as needs change. You know how that is. Yes. And we've been able to do that over the years and adapt to serve whatever the needs are, like human trafficking, when that's become such a big issue in our community in particular.
Terribly sad too, and definitely a big part of it. But I mean, as everyone just heard, I mean, you guys are doing so many different things and so many different aspects, 1960s to today. How did you actually get involved in doing this? And you touched on it, and I want to continue talking about it. It is Mental Health Awareness Month, so why is mental health awareness important to our community and for the Camilas House? So how did you get involved, and how does mental health fit into that?
So I am probably an aberration in terms of the typical person who gets involved in this issue. I do not have a degree in social services, a master's of social work, psychology, psychiatry. Far from it. I have a minor in sociology, but it's a lot different. But I became involved because I had an opportunity. I was working at the county at the time to join at its infancy stage the Miami-Dade County Homeless Trust as it was being developed and put together to manage a dedicated source of funding that this community has been collecting since 1994. The first of its kind dedicated source of funding for homelessness and victims of domestic violence. And because of that funding source, we were able to develop a system of care that today is considered a best practice nationally that allowed us to leverage millions and millions of federal dollars and other government dollars to bring resources to bear. And I know that, you drive through right now Miami and you see a lot of tents, you're seeing a lot of more visible homeless presence that we've seen in a very, very long time. But, our homeless counts indicate that we have a little over 1,000 homeless people living on our streets. I've had the opportunity to visit Skid Row in LA personally, to walk the streets of Skid Row in LA. You're talking 54,000 homeless people in LA County, and hundreds and hundreds and hundreds, I'd say probably thousands just in Skid Row alone. You look at New York, 65,000 people. I mean, homelessness is not unique to Miami, but I believe that our county, because of the efforts it did almost 25 years ago to get a system underway, has been able to address it in a different way so that we do not have that incredible volume of homeless people. And I was very blessed to be brought on at the very beginning in 1994, and I worked with the Homeless Trust. I eventually became its director. They are a funder and a coordinator of the system. I'd never run a social service agency. I actually left a homeless trust and did a lot of other stuff that was interesting, and had 4.5 years ago, got a call to consider coming to Camilas House, at the time looking for an executive director. Great organization. And I said, there's got to be a reason why I'm getting this call. And I decided to come back into the homeless arena. It's something that I've always been passionate about, because I believe there's just, I don't know that a lot of people understand the great need, the reasons why people become homeless, what it really takes to stop that cycle of homelessness, to know that it can be done, because we've seen it done in Miami. And to want to be part of a system that, look, I go home every day. A lot of people have fulfilling jobs. So let me tell you, when I'm walking in my car and someone says, "Hi, Miss Hilda, how's it going?" And, it's like, hey, and they look and they have a smile on their face and they're not sleeping in the street and eating out of a trash can. I feel like, hey, we did something good today. We did, because it's not one person here. It's an incredible organization and a lot of passion and committed people.
No, and I've gotten a chance and the pleasure to spend some time at the Camilas House and meet some of the great people that are definitely there in your supporting cast and making sure that this all gets done. And like I said, you guys, it's so impressive. You have so many different services and hitting on so many important issues. But let's focus in on those issues. Because how can our business community, like what are those issues, and how can our business community help and support your mission at the Camilas House?
Listen, I wouldn't be a good and true director of a nonprofit agency if then I'd say, well, money always helps, right?
Yeah, I'm giving you the floor and the platform. Let's do it.
I gotta throw that out there, And like a lot of nonprofits, look, that's a challenge. I'm not going to lie. Fundraising is always an issue for us. We happen to be an organization where 45% of our funding does not come from governmental sources. There's some agencies that rely on governmental sources as a big part of what they do. And that's not us, So we do rely on the incredible generosity of people, of corporations, family foundations, and individuals who know what we do and feel confident. And I hope they do, because I can assure you we do, that any contribution they give us, whether it's that $5 that comes in through the mail or $500 that they gave us on Give Miami-Dade or whatever it is going to be put to good use. It is. We provide the only day center in Miami-Dade County for street homeless people to come in and take a shower, get a change of clothing, get a hot breakfast, get their mail. We give them an address while they're still living on the street. They can come in here and get their mail. All of this provided no cost. We provide identification. If they don't have it, we help them get a Florida resident ID card. If we need to pay for a birth certificate, we do that. We have on-site legal services. We have on-site career services. We do interesting things like art therapy, because you'd be surprised at the incredible art and incredible talent a lot of our homeless people have that is, lost to a lot of people. But we provide a lot of these services, unique services, even to people that we are not serving in a residential capacity. And we're very proud of that. And that takes money. Those are not the kinds of services that, while they are needed, are traditionally funded by government resources right now. So fundraising is a big part. But most importantly, we call it the trifecta: time, talent, and treasure. There are so many other ways that we need support. We are rehabilitating, we're getting people ready to go back on their own. Well, they need, if they're not disabled, they're going to need to get a job. We need people to give our clients who are working their way back, who are in this journey to recovery and to independence. We need people to give them a chance, give them a break. We understand, that there could be some hesitancy, but we're going to stand behind the clients. We're going to send work-ready, capable people that want to work and are going to show up, or we're not going to send them to people in the community willing to take a chance and offer an opportunity to a homeless person. Look, I'm an employer. Like, you're all our employers, right? It's always a crapshoot. I can go on Indeed and knock down 20 resumes, and I can hire someone and they still not work out. So, we realize we're not going to bat 1,000 either, but we'd like to give a chance for our people to get out of that, the batting circle, right? And get on the plate and try to take a swing at getting back on board. God, all these metaphors, but, and get a chance to really get back on their feet. And so we need people to consider that. Consider giving a homeless person. You've got an opening, we've got people of all skill sets, but we'll send you the person that best meets whatever you need. The second thing is, our people are also going to need a place to stay, right? The cure for homelessness is giving them housing. You got to do a lot of things to give them that. So we're blessed that we do have this, really good contingency of landlords that will work with us, understanding that they're going to have people refer to them with bad credit histories, maybe some criminal, a criminal background, a lot of it misdemeanors, but still criminal background. So, we again stand behind them. On many occasions, we'll sign the master lease, the initial lease on behalf of the client, and eventually the client, will transition the lease to the client. But, landlords willing to work with us, to be able to provide safe and decent housing. It is not helpful for us to put people in housing in the same neighborhoods when they're in recovery from, a block and a half away from like where they used to get, their crack or wherever it is. So we've got to give them safe and decent places to live. And so we always look for landlords willing to work with us, and they're going to have Camillus standing behind them. We've been around 60 years and we plan to be around another 60, we're going to be there if there's ever an issue to stand behind, our client and resolve it. Again, I'm going to bat 1,000, but if you're a landlord, you don't bat 1,000 all the time either. So,
well, I mean, with your passion, there's no doubt it's going to continue being successful. It's awesome to hear all these things because, I wish there was more people doing more, obviously, to help our community rebound from these things. Being Mental Health Awareness Month, what are talk just real quickly about the Camilas Health Center program and the community outreach sites. What is Camilas House doing particularly for mental healthness?
So we run residential treatment programs. We work with a jail diversion program at the courts that actually diverts clients that really need mental health services rather than keeping them incarcerated without providing that. We're actually the jail diversion site, so they'll bring clients to us. But we run comprehensive mental health and substance abuse treatment programs. We have group and individual therapy daily. The folks in those programs, it's intense. We are DCF licensed. We are CARF accredited. So, we are, sorry about that. So, we've been doing this for many, many years.
You didn't even miss a beat. I love it.
Yeah. You gotta be nimble.
I gotcha.
So, we've been doing this for a very long time. In fact, we've been providing licensed mental health services. My Lord, what is wrong with people here?
Yeah, you're good.
So we've been providing those services since the early, in the 80s. And, now again, we're CARF accredited even. We're one of the few accredited homeless agencies.
Okay.
So we're very proud of the depth of services that we provide, the many graduates we have of our program that move on to, and people are not getting the message. I get into the phone call that move on to. I'm
going to reach through the camera and unplug that thing for you.
Yeah, really. Very productive lives and come back and actually talk to our graduates and share with them the experience. We have a lot of amazing people work for us in leadership positions that themselves were graduates of our programs and give you awesome examples of, life after homelessness, life after addiction, life after mental illness. But we provide the county's specialized outreach services on the street, trying to convince, in a very interesting program, it's called the Lazarus Project, severely mentally ill homeless individuals that are so severely mentally ill. That's what people do not understand. Why is that guy out there, man? Services, why don't they come in? Why didn't you just pick them up and bring them in? Well, yeah, I wish it could be that simple. The bottom line is we are a country of laws, so we cannot force people into treatment, and we cannot force them into housing. And we have people in our community that are so severely mentally ill that they cannot cogitate. They cannot have a conversation with you. They do not understand there's resources, there's housing and services. So we have an incredible team that includes a psychiatric nurse practitioner, a clinician, a case manager, a peer. They go out on the street every day and they engage. It could take months, sometimes years. They engage the severely mentally ill people in our community that are homeless through, here's a bottled water, here's a socks or whatever. And it may take a while, eventually convince them through a trust building relationship to let us assess them. And believe it or not, we medicate these individuals with psychiatric meds on the street, often for months, to get them stable enough to then have that conversation about, hey, let's talk about housing and let's get you in. And that's a very successful program. We're very proud of that. We're rolling out a program similar to work with the severely addicted individuals. And, addiction is a disease. I mean, whether you want to say, well, people started it on their own, whatever, but eventually it's a crippling disease. And you'll find people who suffer addiction end up often having chemical imbalances, getting what we call co-occurring issues. And likewise, severely mentally ill people who are not medicated, who will self-medicate with illegal drugs. So when we deal with a lot of our homeless clients, we do see a lot of mental illness. Either they had a mental illness that created the homelessness, or the homelessness itself eventually created a mental illness. And we do see a lot of co-occurring issues: mental illness, substance abuse, and then you throw in physical disabilities. The act of being homeless, you're not eating well, so now you've got hypertension, diabetes, and a lot of these nutrition affected diseases. And these folks, they need a lot of help. They need a lot of help.
I'd imagine so. And I mean, that definitely illustrates why you need such a diverse team and obviously offer such a diverse amount of services. It just seems like so many challenges to kind of I would assume that once you figure out one thing, it's just something else next, and you really don't know what your day is going to be full of. With all these different issues coming at you guys. And you guys are, again, a nonprofit providing all these services. I mean, you talked about the funding numbers, utterly amazing that, a lot of it's coming from private more so than public, which is incredible because that's always a controversial topic.
Yes.
Homelessness is always finds its way into some sort of political conversation somewhere, you know, and so I think it's just a really important thing. And when people think of homelessness, I think sometimes they forget about the mental health side of things, and just giving shelter isn't good enough, and having all these other additional services there that you talk about and how important it is. Like, you just can't pull that person off the street and stick them in a house and think that they're just going to be okay. And the idea that you talk about with, you know, we have a lot of multifamily real estate developer clients that own a tremendous amount of real estate, and I know for fact that several of them have assisted in placing some of the homeless in their properties and going through that rehabilitation process, and how rewarding that's been for them. So any of them that are tuning in now and that haven't done it, I encourage you to look into it. There's obviously great benefits of doing it too. But you know, one of those is just that you're actually helping someone rebound from a tough situation. Maybe they just were in an unfortunate situation at one point, like you said. You know, sometimes the addiction may start because they made a decision to do something, but it is a disease and it's something you need help kicking. And without organizations like yours, I mean, a lot of times it's just not even possible. We are in storm season as well, so I wanted to hit on real fast, and we got to wrap up. We are. I'm so happy to have you on today, honestly, to talk about these important issues that are definitely need more attention. No matter how much they get, they always need more. But what do you guys do, and what are you doing to prepare this storm season, seeing that we kind of are, I guess, wrapping up the pandemic, if you will, in some regard, going kind of back to normal. I'm doing a lot of air quotes here. And
Normal, at least.
what are you guys doing differently this season to prepare for the hurricane season?
So, you know, it's kind of really interesting when this pandemic first hit. On March 1st of last year, we had an emergency response plan that was because of the way, the nature of our, you know, we're a large organization and we have to shelter our clients in place. It isn't optional. It's, you know, our main facility was built to Category 5. So our emergency response plan is, how do we keep everyone safe here and in our 9 other sites? You know, how do we ensure that we have 2 sites that have to be evacuated if evacuation orders are issued, and they're permanent housing sites, but we want to make sure they know what they have to take to shelter, you know. And even our clients, we had one property that when we evacuated in the past, we had to send staff with them. We're not going to send our clients, they were a treatment program, to a shelter by themselves. So we have to have comprehensive plans, you know. And then not only that, not only do we shelter our clients that are here already, we open our doors and admit people from the street. We took in 265 additional people during Hurricane Irma, because no matter what, they're going to be safer inside our walls, and they're going to be out, you know, under an overpass or what have you. So we have to have, you know, our emergency response plans had us a month ago, because we have to go in on June 1st with the expectation that on June 1st we can get our first storm. And so our supplies are huge. We had, you know, from everything. Imagine water when you have 400 people living here, what you have to supply up for water, what you have to supply up for food, the kind of food that you'd be able to then use if you had to shut down your dining hall because you're in the middle of a, you know, tropical storm force weather, and we cannot have people walk outside to get to the dining hall, and we have to do that. So it's a comprehensive plan. It involves when if an evacuation order is lifted, or tropical storm warning, you know, how do we do protection? Right now, you know, a lot of our facilities are older. Risk mitigation for us is, you know, we're having to retrofit a lot of our facilities, and we cannot afford to put impact windows. So that means, you know, shutters. What's the fastest thing to do? We don't have thousands of employees that we can put, you know, panels up, and that's unfortunately what we have in some sites. So we spent a lot of time in the off season, in spite of COVID, preparing for the storm season in particular, saying, okay, well, what are we going to start retrofitting? So we have some facilities that are only 50% shutter, you know, with shutters, and the other 50% have to be put up because we don't have the funding to do it all at one time. But we've spent a lot of time, you know, just kind of making sure that by June 1st, we have to be ready by June 1st. We don't take a chance. We have planning meetings. We have a planning team. The planning team meets. We've adopted technology. WhatsApp became one of the most effective tools during our emergency recovery process during Irma. as a means of communicating, believe it or not. So, we've embraced every time we can, even our post-storm, risk assess, what we do a risk assessment ahead of time, and then we do a post-assessment on damage. We have a process for that. We send out people to assess damage in our different facilities following one standard. We've become regrettably incredibly savvy on FEMA in terms of, filing FEMA claims, but we know how that is, you don't necessarily get reimbursed. It's a challenge, and working honestly with our insurers to make sure they understand, and when we've had to file claims, what the situation is, and they've been really great. We have two really good partners that help us. And after the last storm, Irma really created a lot of, you talked about wind-driven rain. This is a facility that's 9 years old, and we had damage from wind-driven rain in a building built to Cat 5. Because our higher floors were on the east side of the campus were exposed to such severe winds with rain that we actually had water intrusion. So lots of lessons learned, after these emergencies, and planning to make sure those issues don't happen again. So we took a lot of time, the last 6 months to just kind of prep. We really had no choice.
Well, we might have to take a look into how that wind-driven rain was handled. Because at the time that Irma hit, and why I made a mention of it, the policy forms were typically and most often not as the insurers led the consumers to believe, or as they were applied to those situations. They were improperly applied, and we saw insurers turn around and actually do pay many of our clients the millions of dollars they were owed rather than the $100,000 limit or whatever it may have been. So it's an important issue. That's why I made a comment earlier. The insurers have gone back, rewritten a lot of those forms. That's why we're talking about it now, because now it's actually written into some of the policies as something separate. But how can our audience find out about Camilas House, about the events that are coming up, particularly the gala? I know it was, you guys did a virtual one, which obviously has issues. But how can our audience find out about all the great things that you guys are doing and get involved?
Certainly online, Camillus.org, www.camillus.org, Camillus, 1 M, 2 L's. And follow us on Facebook, Instagram. We post a lot of the upcoming events, things that are happening, a lot of the stories, actual stories of, what happens when somebody, we had somebody donate a piano last week. We put that piano right in our courtyard pavilion and we have clients sitting there and, entertaining other clients. I mean, it's someone wouldn't think about that. We didn't say, oh, let's sell it. We will maybe at some point, but right now it's providing something like that. It's music soothes the soul and all of that. This has been a very stressful time for a lot of our clients. So you never know how you can help. There's many ways of help. We have people who want to volunteer, come in and serve in our meals, help us. We run a clothing program for street homeless and, a shower program, help us sort the clothing that's donated, do hygiene, product drives for our shower program. There's so many ways of helping. Camillus.org tells you if you want to help, you can make a casserole at home. We give you 3 recipes. It's called the Cook Program, and you can help us feed homeless people that are coming in off the street to eat lunch here, or the ones that leave here. We have 400 people live in this facility. It's a lot of meals. We serve 16,000 meals a month. So, there's a lot of ways of helping. And again, I wouldn't be a good nonprofit CEO if I didn't say, and of course, cash is always great, but there's so many other ways to help, and maybe in a way that your organization can also come in and and do some hands-on work as well. Make it a service day and see where where the services are going and where the money that you may be providing us is being put to good use.
Yeah, I encourage all of you to go out there, check out the facilities. It's awesome. I've been there personally. I've done the donations. We actually helped feed the homeless at one point. So awesome. So thank you so much, Hilda, for joining us today. This has been a great opportunity, I believe, for our audience to learn about what you guys do. If you weren't aware, if you do know about the Camilas House, like myself, you probably are going to walk away with this knowing even more, because I certainly learned a few more things. And the focus on mental health, I think, is so important. And for people to realize that it's just not about providing shelter. There's so much more that goes into it. It costs a lot of money, so I encourage everyone to donate, obviously. But the donations don't always have to be cash, as you mentioned. There's so many other ways to help and give back. So I encourage everyone to do that. So Hilda, thank you so much for joining us. We wish you the best this storm season. And if there's anything that our GlobalPro family can do, please let us know.
Thank you. And thank you for the opportunity to share with you guys today.
Alrighty. Well, that was awesome, guys. I'm so excited to have Camilas House, Hilda Fernandez. I mean, awesome. I mean, you heard it right from her. She just provided us so much information about what they're doing, and you can just see about her passion and the delivery of the information and her knowledge in the operations and how intimately she's involved in everything that's going on there. And as she talked about the we versus I and the team that it takes to actually do what they're doing there. So I encourage all of you to check out their website, go online, look at it. And again, I think the Break the Stigma, that whole trend is about, reaching out to friends and family, checking in on people, ask them how they're going, it's particularly as we're getting back to normal, as with the rollback of a lot of these regulations for the pandemic, whether it's, the lockdowns to the mask wearing to the vaccination, a lot of issues became so politicized that people are, I think, at times afraid to even talk about them. So reach out to your friends and family, talk about these things, ask them how they're doing. I mean, just random people. If you have an opportunity to engage and talk about things, get to know people a little bit more. It's amazing how those few seconds or minutes spending with a stranger or a client or a family member or friend may actually relieve some stress and may get them thinking differently, may find their way better in life and help them in dealing with something, because we do all carry a lot with us, and I think it's an important message. I think it's an important thing. I know at GlobalPro, we are always doing a lot to help our community, but we are also doing stuff internally with our team, whether it's the health and fitness programs that we do, where we bring in yoga instructors. We brought in someone to teach us about mindfulness. I think as in my position, like Hilda, I think it's important that we acknowledge the efforts of our team and what they're doing, but we also make sure that we look at them and make sure that mentally that they're doing okay. And being healthy is not just physical, it's also mental. So really important message. But on that note, guys, thank you so much for joining us today. I think there's a lot there. I think this is an important episode. 51st episode. It's their 61st year. What a coincidence. But all that well, but stay with us as we continue to count down to 10 years. We're celebrating all the great things that we have done here at GlobalPro, that our community has, that we've been involved in, whether it's Camilas House and many other charities that have really given back to our community and helping it rebound from loss and disaster, whether it's the pandemic and the storms. But continue to tune in every week at 11 o'clock. We want to provide you the information you need, and the best way to do that is hit the like button, follow us, subscribe to our YouTube channel, get all the updates you need, or check us out online at getglobalpro.com. We'll see you next week on the Recovery Report Live.